So, medication management for patients and caregivers, Module 8. In Module 8, we are going to be talking about communicating with healthcare providers. Again, this is presented by Dr. Olufemi Williams, and you can contact us at school.com/mywebpharmacist. There you can find modules 1 to 7 already posted, and now we are talking about module 8. So, communicating with healthcare providers. My Web Pharmacist is a community where we support women and men 40 plus in safely managing theirs and their loved ones' medications, minimizing the risk from side effects and interactions. Also, we have a very modern weight loss program where you have 5 weight loss programs to choose from, depending on what suits you best. And the plan is to get you to lose your first 10 to 20 pounds in the next 30 to 90 days. Yes. So, and this is the course. This is how it's presented. And the general course objective is to empower patients and caregivers to safely manage medications, improve their understanding of medication use and adherence, build skills to prevent medication errors and manage side effects, and to promote the active participation in healthcare decisions. You are the one going to take the medication. You should be an active participant. Now, in Module 8, communicating with healthcare providers, the learning outcomes, we want you to build confidence in discussing medications with your doctors, pharmacists, or nurses. Your healthcare providers are human beings. You should be able to communicate with them and build that confidence. Don't just say, oh, they gave me this. I've spoken with many people who say, yeah, the doctor gave me and I just take it. No, you should be an active participant in your healthcare. So, we want to all this in this module. We want to teach you to learn to. We want to teach you to ask the right questions and advocate for yourself or your loved one. It's very important. So the topics we're going to be treating today: how to prepare for a doctor's visit, bringing your medication list. I'm going to show you how to make that very easy. Questions to ask about new medications, the side effects and alternatives, understanding your prescription, what does it mean, and the role of the pharmacist, how they can help you manage medications. So first, preparing for a doctor's visit. Bring your medication list. Now, what some doctors say, they say, oh, bring all your bottles. That can be very cumbersome. So, as I told you and as I showed you at the beginning of the course, you should have a medication profile like this. Just go to drugs.com/mednotes. This is one that I created just as a sample. And you can have an app on your phone. So, this website allows you to have an app. So, Mr. Wellness is not a real person, but he has 7 drugs he takes. Here are the 7 drugs. On each one, it says the drug, you know, and all this information. Very, very clear. Now, he has 4 health conditions: diabetes, high blood pressure, high cholesterol, vitamin deficiency. He has 2 allergies. It's very clear. So it's so clear, it's so clear. And then the report so far for this patient, talking about his drug interactions, which ones are moderate and which ones are major. Now, most doctors will not write 2 medications that have major drug interactions, but a lot of times we see doctors writing drugs that have moderate interaction or probably mild ones. Now, what happens is that the doctor might decide to give you some medications that interact, but they are monitoring you. And also, they might say the benefits outweigh the risks. So in those cases, we just let the doctor know and let the doctor confirm that he or she is aware that the drugs interact. So sometimes you might find some of your drugs are interacting, but probably the doctor has given us the go ahead. But there's no harm in pointing it out to the doctor because it will all show in your med profile that you create. So you will see it. You will not be just taking medications because somebody told you to take it. You will see, oh, these drugs, okay, they interact. What kind of interaction is it? You can see here. This one tells you the interactions, what can happen, bone, muscle damage occurs with things like atorvastatin. So you can read the details and see, oh, is this why I'm feeling like this? Maybe it's the interaction, things like that. So it's good for you to know what's going on. Don't just be there and be taking things without having any idea what's going on. So you have your med profile, you check for yourself or for the person you are taking care of. So it's very important. And if you don't want to take it as on your phone to the doctor's office, you can always print out the whole thing. Print it out and let the doctor see the whole profile. But it's good. I love this thing. It shows your health conditions, shows your allergies. When the doctor prescribes a new medication, all you have to do is add it, add the drug, and if there's any interaction with what you're already taking, it will catch it. So that helps the doctor too. It helps you and also helps the doctor. So that's bring your med list. Write down questions or concerns ahead of time. I cannot emphasize this, I cannot emphasize this more. That I have to keep on telling people. Write down your questions before you get to the doctor's office. The doctor might not give you more than 15 minutes. So when you get there, they've checked all kinds of things. All the questions you had during the month or 3 months that you are not there, write it down. Say, doctor, I have these questions. I have these concerns. Let the doctor answer you. They are the specialist. Let them answer you. And then, if you have any clarification, if they are adding any new medication, ask for clarification. Whatever question you have, they will answer you. You can ask questions like, what is this medication for? Oh, what about the medication I was taking before for this? Am I going to be continuing it? Which medication is this replacing? Which ones should I be stopping? Which one should I continue? And the doctor luckily can see your list that you brought on your phone or on your app or on your printout. The doctor can see it and say, oh, okay, you are no longer going to be taking this. Remove these ones from from your medications. And then ask, what are the side effects I'm going to be experiencing? Are they going to be at the beginning and go away after some time? Or am I going to always have these side effects? Are there any alternatives? Are there things I can take? Are there cheaper alternatives? Or whatever questions you have, write them down before you get to the doctor's office. Then understanding your prescription. Review the medication name, dose, and frequency. Sometimes some medications sound to you the same. We know they are different, but to you they might all sound the same. Always review it. Check the medication you are using, the name, the dose, how many times a day. Ask about if there's any food, drug, or activity restrictions. Now, when I take this drug, can I drive? Can I, do my work? I'm a truck driver. I'm a welder. I'm this. Can I take this medication? Some medications we tell the patients, oh, you can't do this kind of work when you're taking this medication. And then refill instructions. How long should this treatment last? Is this treatment just for a short period or is it, should I keep refilling it? Sometimes some patients get some medications in the emergency room or maybe just after an operation, which was supposed to be for a short time, but they go to their primary doctor and keep on asking for refills. There are sometimes things that they are not supposed to continue. So always find out, why am I taking this medication? Should I continue it? And things like that. And let everybody know. Let the pharmacist also know to remove it, put it on hold on your profile so they don't keep faxing the doctor for refills. And then sometimes some people will call the pharmacist and say, oh, refill all my medications without telling the pharmacist which ones they no longer take. That should not be so. Try to get the everybody on board. Yourself, the doctor's office, the provider, and the pharmacist. Let them all know what's going on so that you don't keep on taking medications that you should not be taking. So the pharmacist will you can ask your pharmacist about the side effects again. But as I told you, for those of you who can use the computer, this is a fantastic website. It will tell you a lot of information. And then when you get information from here, if it's still not clear, then you can tell the pharmacist, this is what I found out about this medication. What do you think? What is your advice? On the side effects, on the interactions, and the pharmacist will clarify any confusion regarding your medications. The pharmacist will also provide advice on safe over the counter medications that you can use during your ongoing therapy. So the pharmacist will be able to say, oh, no, don't take this, or you can take this, and things like that. So that concludes the module on communicating with healthcare providers. This is important. It might not seem important now, but it is very important because it is how you communicate with the healthcare provider that will decide how the healthcare provider decides to adjust your medications. So please do not underestimate this part of the training. It is very, very, very important. Writing down your questions before you get to the doctor's office, asking as many questions as you can. If you can't ask the doctor, ask the pharmacist. And this is very, very important because they are all depending on you to give them feedback. And if they don't have feedback from you, they will just make assumptions that everything is okay. So you, the patient or the caregiver, is the one who will help your healthcare providers to determine the best course of action for you. So, and if you have any questions, just join us at school.com/mywebpharmacist and you'll be able to get your questions answered there. And we have a very robust program. We support women and men 40 plus in safely managing theirs and their loved ones' medications, minimizing risk from side effects and interactions. We also have a very modern weight loss program. We have about 5 programs you can choose from, depending on whichever one will you decide works well for you. And we plan to help you lose your first 10 to 20 pounds in the next 30 to 90 days. And this is a very robust and well tested weight loss program. So, in module 9, which is the last of the modules, we'll be talking about the practical tools and resources for medication management. There will show you again this website that I love so much. The tools and resources to simplify medication management, access to additional support for long-term medication care. Then there are the mobile apps, we've got the topics, the mobile apps. All these we'll talk about, and where to find trusted online resources, support groups, community resources for caregivers and patients, accessing financial help for medications. And that is what we'll be talking about in Module 9. And thank you very much for listening. And we hope to see you in our community, school.com/mywebpharmacist.